What is halachic health in the context of Jewish law? Have you ever wondered how Jewish law influences health and medical care? This brings us to the concept of halachic health, which is deeply rooted in Jewish law, known as halachah. At its essence, halachic health encompasses the obligations, permissions, and restrictions related to health, healing, and medical decisions according to Jewish principles. The foundation of halachah is the belief that life is sacred. This perspective mandates that preserving life and maintaining human dignity is of utmost importance. A key principle is the obligation to seek healing when one is ill. This is based on a commandment from the Torah that instructs individuals to cause him to be thoroughly healed. Therefore, seeking medical treatment is not just allowed, it is often required. Neglecting to provide treatment can be seen as causing harm. Halachic health includes several important concepts. First, there is the obligation to heal and preserve life. Jewish law encourages individuals to actively pursue health and healing. Medical treatment is viewed as cooperating with divine will, as healing reflects God's mercy. However, halachah also recognizes limits on medical intervention. While preserving life is essential, there are circumstances where extending life may not be necessary. For instance, if a person is considered on the brink of death, with a very limited life expectancy, aggressive treatments might not be required. However, it is important to note that hastening death is not permitted, and nutrition and hydration should be maintained unless death is imminent. When it comes to making medical decisions, halachah acknowledges the complexities involved. This is where a Halachic Health Care Proxy comes into play. This legal document allows observant Jews to designate someone to make medical decisions on their behalf, ensuring that these choices align with halachic principles, especially when the patient is unable to decide for themselves. Halachic health also permits the use of alternative medicine. Jewish law allows individuals to seek healing through various means, including complementary and alternative therapies, as long as these methods do not conflict with halachic prohibitions. The obligation to heal can sometimes take precedence over certain restrictions when a patient's health is at serious risk. Ethical boundaries are also a critical aspect of halachic health. Jewish law strictly prohibits actions like euthanasia or intentionally shortening life, as life is viewed as a divine gift. Medical interventions must respect these boundaries, balancing the need to save life with compassion for those who are suffering. In practical terms, halachic health serves as a guide for observant Jews navigating medical care in alignment with their faith. This includes consulting knowledgeable rabbinic authorities when faced with complex health decisions, ensuring that treatments comply with halachic standards, and utilizing health care proxies to uphold religious values in medical contexts. Overall, halachic health integrates religious law with modern medical ethics, highlighting the sanctity of life and the responsibility to seek healing while carefully considering medical interventions within a framework of Jewish legal and moral principles.